Hi, everybody. Today I'm going to talk about COVID-19 and the heart of the athlete. Moderate exercise to boost immune function has been at the forefront of exercise recommendations during the SARS-CoV-2 pandemic. In this piece, I will identify the most common athletic concerns and what to do if you have had a COVID infection before you return to sport. The immunological benefits of moderate exercise and conversely the potential for increasing inflammation and infection with more intense and sustained exertion have driven the recommendations during the pandemic. With a bit of daylight in diminishing cases, we begin to plan the re-entry to sport with considerations to protect the heart. Athlete participation has had a complete pause for most Americans in the weeks following cancellation of the NCAA tournament. Like dominoes, every major sporting event and competition was canceled all the way down to youth sports. For the past several months, we've been practicing skills and exertion at home in isolation. As we begin our re-entry, a major concern for all athletes is the reconditioning process, as during the pandemic, many have deconditioned. Cardiovascular fitness is the foundation of performance science. Here I will explore some considerations that you and your organizations should bear in mind as you gear up for the return to sport. What if you have not had a recent COVID infection and feel fine? Deconditioning is the primary concern athletes will face as sports participation begins. It is important to address this first with use of a fitness schedule that supports cardiovascular exercise. While it is tempting to try to pick up where you left off, starting slowly and rebuilding can help to prevent injury. Utilizing a heart rate monitor, you can methodically begin exercise and progress exertion, meaning that the heart rate can specifically guide your response to exercise. So if, let's say, you take a jog for 25 minutes or a half hour and you cover approximately 3 to 5 miles and your pace is set at 8 or 9 or 10-minute miles and your average heart rate is 150 to 160. That's a good starting point, and you can then use that heart rate 150 to 160 to guide duration. So you might go from 25 minutes to 30 minutes, from 30 minutes to 35 minutes, or you might increase your intensity. You might decide you're going to exercise for 25 minutes to a half hour, but at a higher heart rate, 155 to 160, 160 to 165, 165 to 170. And that progression should include a symptom inventory. It is also possible that people may have had exposure to the novel coronavirus without significant symptoms. If symptoms such as shortness of breath, fatigue, or chest pain occur, further evaluation with your doctor should commence immediately. If you have had COVID disease, for many healthy young adults and adolescents, COVID causes a mild respiratory illness that does not require hospitalization. Exercise during an active infection is never a good idea and can lead to permanent damage of the heart or even death. That being said, SARS-CoV-2 infection is known to include the additional risk of an infection of your heart. Exercise should follow a waiting period after complete recovery of at least 2 weeks in mild cases. And for competitive athletes with known cardiac involvement, a waiting period of at least 3 to 6 months is currently recommended. In any event, an evaluation with your sports doctor prior to initiation of exercise is important, given the lack of knowledge regarding the impact of this disease in the short and long term. If you have had COVID infection, consult with your sports doctor. Because the virus can attack the angiotensin receptor, there is direct risk to the entire cardiovascular system. Specifically, the virus can cause myocarditis. Symptoms of this might include shortness of breath, chest pain, or this can be a silent asymptomatic infection of the heart. Sudden cardiac death is a concern for competitive sports, and this is a risk for which we screen most athletes at the collegiate and elite athlete levels each preseason. After an active infection with coronavirus, we are recommending athletes consult with their sports doctor for evaluation and consideration for further testing prior to heavy exertional training, live practices, or sport. For more guidance, there is an algorithm attached to the blog post on the website. Please see this for further details. For recreational athletes, some common sense guidelines should be employed. Physical distance of about 6 feet while exercising is important. More vigorous exercise should prompt increased distance from others, as the potential for droplets to travel further with running and biking has been suggested in studies up to 20 meters. Currently, exercising with a mask on is not recommended, but having a face covering handy for times at which proximity to others is unavoidable can help diminish the risk of infection from asymptomatic carriers. Organizations and teams must have policies regarding cardiac clearance prior to return to sport. While pre-participation requirements are relaxed at this time due to the potential obstacles in access to physician care, athletes known to have had an infection should not participate until appropriate evaluation and workup is completed. Suspected cases and contacts of those infected must be tested with appropriate isolation from the team according to isolation policies. In the absence of active infection, coaches must be aware of the risk of injury, including cardiac concerns. A methodical, foundational progression is essential prior to live training. We are recommending at least a 3-week course of reconditioning prior to engagement in live practices or competition. Again, heart rate monitoring can be a vital tool in identifying fatigue and guiding progression. As the data increase over time, recommendations for COVID-19 treatment and follow-up will certainly evolve as well. All individuals should eliminate exercise if there is concern for any viral syndrome, especially if febrile. In cases of myocarditis or other cardiac injury, a waiting period of at least 3 to 6 months before re-entry to vigorous exercise is recommended. Even in mild illness, viral infections can cause myocarditis. Never exercise during an acute febrile illness. Myocarditis can occur with other viral infections, but in particular, SARS-CoV-2 can increase the risk of sudden cardiac death with myocarditis by up to 20%. See your sports doctor if there are any further concerns, and I look forward to seeing you all again soon. Be well and be safe. If you like these videos, if you find the information useful, please like, share, subscribe, and look at my website, docbots.com, for more information.